Okay. First, I would like to ask you permission to use this video for educational purpose and on internet.
That's fine.
Thank you. Now, first of all, you're here because you have pain in the lower back. Is that correct?
Correct.
1 to 10, how bad is that pain?
About 6 right now.
And how bad can it get?
9.
So your pain is 6 to 9. Is that correct? In the lower back.
Yep.
And
down my legs.
And down. But let's talk about the lower back.
Okay.
How long have you had that pain?
6 years?
6 years. How bad is it in the last few years getting worse?
Yes.
Okay.
Way worse.
Okay. So it has been there for 6 years, but in the last few years it's getting really bad, up to 9 of 10 in the lower back.
Yep.
Can you point to that pain?
Right
Okay,
here.
right there. Got it. Now you have as well leg pain. Is that correct?
Yes.
The leg pain, 1 to 10. How bad is that?
Anywhere from 6 to 8.
6 to 8. And is it right, left, or both?
Both. It's worse down my right.
So right equal left. That's how I'm documenting it. Now, is it pain mostly above the knee or mostly below the knee?
In the right, it goes all the way down to the toe.
Okay,
My big toe.
Okay, but the worst pain, is it mostly
In my thighs.
in the thigh? So
Yep.
above the knee is worse than below
Yep.
the knee. Now let's talk about where the pain really is now. Is it where I have my hand right now? Worse here, worse here, worse here, or worse in the back?
I'd say on the sides.
On the side.
Yep.
So I'm going to mark the side with the pain side, and it's both sides.
Yep.
So I'm going to put that there. The part that goes below the knee, is it mostly in the front, side, or back?
It's mostly in the front.
Mostly in the front. Okay. Now, what about the feet? Does it go to your feet?
In the right side it
On
does.
the right side, it does go down to the
I
feet.
get tingling in my toes.
Okay.
They're numb.
Okay. Is it mostly on top or on bottom of the foot?
I'd say both.
In both?
Yeah,
Good. And then is it mostly heel or mostly toe?
both.
Both. So, and the reason I'm
Worse in the toe, I'd say though.
Yeah. Why I'm specific about that, because this is the distribution. This is L2, L3, L4, L5, and bottom and the heel is S1. So you have symptoms that are mostly L4, but as well you have some symptoms in L5 and S1.
That's where I had surgery on.
And here you are. That
And now I'm here.
Exactly. Now, you said you had the surgery. That history is very important.
Yes.
What kind of surgery and when?
I had a microdiscectomy. I
Do you
think
know
that's
what
how
level?
you say it.
Microdiscectomy?
Yeah.
What level?
L4, L5.
L4, 5. When was it?
About 2 years ago.
2 years ago. Did it initially improve your symptoms?
For a year.
For a year, but now it's coming back.
Yes.
What is coming back more, the back pain or the leg pain?
The leg pain. The back
The leg
pain
pain.
never left.
Okay. Back pain is still worse than the leg pain?
Yes.
Leg.
You can put this on the internet.
Yeah.
This would help the insurance companies.
Yeah,
I have been told that I need a fusion,
And we will talk about
but
that.
my insurance company won't do that.
Well, we'll definitely in this minute talk about
Thanks.
that. Okay. You have done physical therapy
Yes.
within the last 2 years.
Yes.
How
I did
many
it right
sessions?
after surgery. I did
How
it
many
for
times did you go there?
3 times a week for 6 weeks.
So 3 times 6 weeks, so
Yep.
more than enough.
Yep.
And then you have done chiropractic treatment, and I see you have done injections, and all of that. Did they help you? Are you better or worse after the injection and the physical therapy?
Well, I was better after the physical therapy because that was right after my surgery.
Okay.
And then I haven't had that since.
So okay, you haven't had physical therapy
No.
since the surgery?
No, and then chiropractor, I did that
Mhm.
way before any of this all started because of
Okay.
insurance purposes.
Okay.
But that made it worse.
Okay.
And
So
then-
what I'm documenting right now is how much physical therapy and other treatment you have done. You don't have-
Injections, I can't even count how many I've had done.
Okay, more than 4. That's more than enough.
Way more.
If we would be here right after the surgery, I would as well document how your wound looked like. I would look at that, and that's what we need to do. And any problem with the bladder or bowel?
I dribble all the time.
Okay, you have some minor bladder incontinence.
Yes.
Minor bladder incontinence. So here is the bladder, minor incontinence. Now, how far can you walk?
I don't
block,
know
5
how
blocks.
far I walk all day. I'm on my feet all day.
Yeah.
Honestly, I don't know how far I walk.
Sure, but can you walk 1, 2, 3
I
blocks?
can walk as far as you want
Okay,
me
so
to.
that's not a limitation, so
No.
unlimited.
But it's gonna hurt.
I know.
Eventually.
I know. Now I'm going to do a test, and if you are okay with that, I'm going to do the test for the video a little more detailed, and as well, do it both for neck, arm, leg, and so on. So we have, people see how it is. Now, a full strength in the extremity is called 5, meaning the normal person has 5 of 5 strength. Somebody who's completely paralyzed has 1 of 5 or 0 of 5 strengths. 1 is when you're barely able to move it, but it's really not mechanically important. 4 is when it's really weak. 3 is when it's anti-gravity. And then 2 is, when it moves a little, when the gravity is not a problem. Like this would be 3, but if I cannot do this, but I can do this, that would be 2. This is 3. So I'm going to go over all the segments and then document that here. So if you turn a little here, let's start with the deltoid. Can you do this? Deltoid is considered D on this form. Keep it up. That's full strength. Now open it up, and now I'm using my the triceps. Keep it straight. Don't let me bend it. Excellent. Now I'm using biceps B. So deltoid D, triceps T, biceps B on this form, and then open up your fingers. These are the lumbricals. They are full strength. Now give me a squeeze. This is grip. Full strength. G on that form. And do this for me. This is thumb opponent. This is not on that list, but sometimes it's important. Now let's check the legs. Can you turn a little more? Put your feet in front of you, and sometimes it's better to take the shoes off, but put the heel in front of you on the ground. Push down now, push. This is obviously gastrocnemius, G on the lower extremity on that form. Bring the toes and the whole foot up. No, not like that, but like this.
Oh, okay.
Good, hold it there. Now this is the tibialis anterior, TA on that form, and this is, without the shoe is even better. The extensor hallucis longus, or EHL. Push it up. Here the same, toe foot and the toe. Now, obviously, this is the quadriceps, one at a time. Lift it up. Keep it straight. Good. Here now. Now, keep it bent like this at 90 degrees, and don't let me open it. And this is hamstring. H on this form. Now we are going to just talk about a little relax now. Relax. Relax. With the hammer is better. And this part you guys don't need to do. This is I do. I always confirm all your exam. And these are the exam. There's something called Hoffman here. Relax here. And if you start jerking with your, don't worry about that. If you start jerking with your other finger when I'm doing that, that would be Hoffman positive. Relax here. And your Hoffman is negative. And then we are going to do the straight leg raise sign, or Lasek sign. Relax here. Let it sit back a little, relax, and make it straight, and then bring it up. Tell me if it's painful. Right now painful?
Yep.
So is it that's a straight leg raise sign is positive. Relax here, relax, let it fall. Is that painful?
Yep.
Okay, then straight leg raise sign is bilaterally positive. And then this is the motor exam and the sensory exam that we documented. And that should be good enough for the history taking. Is there anything else that you think is important for me to know besides previous history of what treatment you have gotten and previous history of any surgeries or otherwise, as well as films? When was the last time you got any films? I see a film from 2014, 10, 28. Is that the most recent films?
God, it shouldn't be.
Okay, so you have newer films than that?
I think so.
Yeah, we will look into that. So, but that is important to know that when was the last film done and where they were done and do we have access to that? Obviously, if you don't have access to that, we cannot evaluate
Right.
them. But I guess that should, sort of cover the basic history taking and basic exam. So, do you have any question, or do you guys have any question before we
I guess I've been
conclude
on.
this?
I mean, half the reason I'm here, I've been on Vicodin for the last 6 years too.
Yes, that's
That's
something that needs to
history
you need
too,
to
I
address.
guess.
Absolutely. Okay, I would say then we conclude that. You can stop recording.